Welcome to Robert Wood Johnson University Hospital, Somerset's Health Talk. I am Dr. Douglas Oshinsky of RWJBarnabas Health Medical Group. In accordance with social distancing due to the COVID-19 pandemic, I am hosting the show from the studio, and our guests will be joining us remotely via video conferencing. Lung cancer is one of the most common cancers in men and women, and by far the leading cause of all cancer deaths. On a positive note, the number of new lung cancer cases continues to decrease due to the decline in smoking and advances in treatment and early detection. During today's show, we will learn more about risk factors for lung cancer, prevention strategies, and the latest screening tools. We are pleased to welcome Kaidlan Ricardo, lung cancer screening coordinator at the Steeplechase Cancer Center at Robert Wood Johnson University Hospital, Somerset. Welcome to the show. Thank you, Kaidlan, for being here. And just so the audience understands, can you describe what you do, a little background on yourself, as well as a little bit about the Steeplechase Cancer Center at Robert Wood Johnson University Hospital, Somerset?
Absolutely. So my name is Kaidlan Ricardo. I am the lung cancer screening coordinator for Robert Wood Johnson Somerset, and we are located in the Steeplechase Cancer Center. Here at Steeplechase, we do offer comprehensive cancer care for various types of cancers. We have our own infusion and chemo suite right here on site, as well as labs. We do mammograms and bone marrow testing here. So we offer a wide range of services to our patients, as well as their families, with support groups, and we try to engage them as much as possible in any type of support we can offer here. And so the Steeplechase Cancer Center offers a lung cancer screening program for qualifying patients. A little bit about myself. So I was a medical assistant for about 10 years, primarily working in women's health before I came into oncology. I started working with Dr. Kathleen Toomey here at the Steeplechase Cancer Center, and then her practice began to grow. We now have Dr. Ishan Patel, Dr. Fei Yin, and so we post-COVID, or sort of, we started opening back up radiology to do screening tests, and we relaunched our lung cancer screening program to the community and to the public.
So, as part of RWJBarnabas Health Steeplechase Cancer Center, what we've done prior to COVID was the low-dose CT scanning for lung cancer. Can you tell us, first of all, what does that even mean?
So the low-dose CTs are the lowest dose of radiation that you can get from a CT scan. It is a scan of the chest, and it is to scan for any early detection of lung cancer, any suspicious nodules or masses that may be present. There's no contrast involved. There's no pre-procedure blood work involved. You come right to our radiology department, you get your quick CT scan, and that's reviewed by our providers here on staff. And should you need any further testing or any imaging or biopsies done, we coordinate that care for our patients.
Years ago, up until about 20 years ago, we used to do chest x-rays on patients in order to see if there was any type of abnormalities. And then multiple studies came out back in the year 2000, 2002, stating that basically by the time they got to be on the routine chest x-ray, it was too late. And that's when they started to see what could be done so that we could do a screening test sooner rather than wait until it was too late. And after multiple testing, that's when they came out with the low-dose CT scanning of the lungs. And is that what you're describing?
Yes, yes. Because it is such a low dose of radiation, it is something that is recommended to do once a year, again, for qualifying patients that meet the criteria. And that's what makes it safer for patients, because of the lowest dose of radiation, that it can be done yearly.
Okay, so let's talk about the lungs themselves. Okay. What is the normal function of the lungs, and what happens if we develop an abnormality?
So the normal function of our lungs, the lungs are our foundational organs of our respiratory system. Their most basic function is facilitating the exchange of gas from our environment into our bloodstream. During respiration, oxygen enters the blood from incoming air and carbon dioxide leaves the blood. This exchange of gases is actually what allows us to breathe. So when lung cancer develops, it's when cells within the lungs rapidly change or mutate, and their natural growth and death cycle is altered. So this results in an unregulated cell division, and an excess of cells are created. So this rapidness of the cell division does not allow for the lungs to function normally or create healthy tissue. Smoking is actually the #1 cause of lung cancer. It's responsible for about 90% of all lung cancer cases. Other common causes of lung cancer are exposure to hazardous chemicals such as radon, uranium, asbestos, and arsenic. Family history and genetics also play a huge part in lung cancer as well for individuals and their chances of developing lung cancer. But unfortunately, lung cancer doesn't always present itself with notable signs or symptoms before it's too late to be caught.
What lung cancer abnormalities are is that you have unregulated growth of abnormal cells. So those abnormal cells may interfere with your ability to oxygenate in order to diffuse, or they could actually cause part of the lung not to receive oxygen at all by compressing it, such as, obstructing it basically, almost like what happens when your wife has been doing a lot of shampooing of her hair in the bathtub and the drain gets clogged. The same thing happens with lung cancer, that it basically stops the ability of everything to go through it. And as we had described, the biggest problem is smoking.
Yes.
We've known about cigarette smoking and what the increased risk of what it does to for increasing the risk of lung cancer. And so the most important thing that people need to learn today, again, as we've said all the time, is that if you smoke, this is the time to stop smoking.
Yes.
Unfortunately,
with lung cancer, symptoms don't always present themselves until more advanced stages of the cancer are present. So this is, again, with lung cancer screening, the early detection is what we're all about. The early detection saves lives because it doesn't always present itself as symptomatic. However, some symptoms could be some shortness of breath, a persistent cough, coughing up blood, extreme weight loss, fatigue.
So again, we got signs and symptoms, shortness of breath, possibly when you're running or you're doing something, you're short of breath much faster than you previously had been, a cough that doesn't go away, constant clearing of the throat, you notice a change in your mucus, that suddenly you either have more mucus or you have less mucus. And then, of course, if you notice any blood, you're coughing up any blood, things to make sure you quickly get over to your primary care doctor and or be referred to someone, a pulmonary specialist, to go to the next step. And again, the importance that we now have at RWJBarnabas Medical Center, Somerset, a lung cancer screening program, and at the same time, if you are a cigarette smoker, a smoke enders program at the same facility.
Yes, so we do work very closely with RWJBarnabas Health Institute for Prevention and Recovery, and we do highly recommend referrals to them for current smokers. And they currently are doing virtual sessions and programs with patients. It's typically an 8-week program, and they offer any type of nicotine replacement therapies that a patient, they find most suitable for that particular patient, anything that works for the patient. They have a wide variety of options, inhalers, gums, patches, to decrease their use of smoking, their use of cigarettes and smoking, and to help decrease that cessation.
Okay, so I am a primary care physician internist. I've got my patient coming in to see me today who's 40 years old. Ever since age 19, they've been smoking approximately 1 pack of cigarettes a day. Okay. What should I be doing at the present time after I encourage them to stop smoking? What is my next step?
So with lung cancer screening, there is criteria and eligibility that a patient must meet. Right now, it is CMS guidelines that a patient has to be of age 50 to qualify. So someone that is 40 and is a current smoker, I would definitely recommend a referral to the Tobacco Quit program. And if there are any concerns, signs, symptoms, a regular CT of the chest without contrast is acceptable. However, it's not covered for the lung cancer screening program until they're age 50.
Okay, so let's say now they're age 50. What do we do now?
So you can send over a referral to our program. And as long as they meet the other criteria, the current criteria is ages 50 to 80, up to 77 for Medicare. Commercial insurances cover up to age 80. They have to be a current or former smoker. If they were a former smoker, they had to have quit within the last 15 years. And they have to have a pack year history of 20 or greater. And pack year is calculated by how many cigarettes are smoked in a day for how many years.
I am going to refer them over to you, the navigator at the lung cancer screening center, and because you know a lot more about what the criteria are, and you're able to work with the patient's insurance in order to get them the benefits.
Yes, so as long as they meet criteria for Medicare, there actually is no authorization required. It's automatically covered for Medicare. They are allowed one screening a year. And for private and commercial insurances, they are also allowed one screening a year. It does require a prior authorization. I've never been denied a patient's coverage for private or commercial insurances. And we also do offer charity care and funding and grants available if patients need it. And so we would reach out to the patient, make sure they get authorized, and then we would get them scheduled on our radiology schedule for the CT scan.
Okay, so I've got a 50-year-old who's got the pack year history. So that means that I can refer them to the lung cancer screening, to you to help get them the lung cancer screening. And then based on current insurance guidelines, you're saying that every year I'll be able to send them up for follow-up.
Yes.
And if they're Medicare or age 65 or above, they also will meet the criteria. And we can do that until age 77, or if they've got a secondary insurance, possibly till age 80.
Yes. Mm-hmm.
Okay. And so you suggest, the suggestion is to do this approximately once a year?
Yes.
And who most likely benefits from this?
So the largest population that benefit from these screenings are current or former smokers that do meet that population, or anyone that does have a personal history of lung cancer. They can be screened only after 5 years of their diagnosis. So anyone that, again, is a current or former smoker would be the best candidate for this program, or anyone that does have a personal history of lung cancer.
Okay, and is there anyone who should not be screened?
Individuals that shouldn't be screened are those that have never been smokers, or individuals that may have been a smoker but are not physically and mentally capable of undergoing any type of surgical intervention or treatments if it was necessary. So we have had older individuals that are not physically capable of going under any type of surgical intervention should they have a positive scan. And those type of discussions are held with our nurse practitioner, Simona Schneider, as it's called a shared decision-making visit. And these visits are mandatory actually through CMS guidelines and for insurance coverage. And so at these discussions, the patient's full medical history, surgical history, family history is all reviewed and taken into consideration if they're actually a qualifying candidate, should they have a positive scan. So anyone that's just not physically or mentally capable of undergoing any type of treatment, if necessary.
So as in any other type of medical procedure, if you come up with a positive test and the patient is not physically or mentally able to follow through with what the next criteria should be or the next procedure, then that's someone who should not be screened unless you're able to physically or mentally improve their situation.
Correct. So for an example, we'd actually had a recent referral of a patient. They met all of the criteria. However, when they came in, these shared decision-making visits are actually only a one-time visit. It is mandatory for their initial baseline scan prior to. And the patient came in, presented himself with, he actually was going through chemo treatment currently for a cancer, and was not even mobile. He was in a wheelchair. His wife was his caretaker. He was an individual that would not have been able to undergo any type of biopsies or further treatments if necessary, should he have gotten a scan. So it was a decision made between the nurse practitioner, his wife, and the patient that they were not going to proceed with any scans.
Now, that shared decision visit, is that with all patients, or is that only with Medicare patients?
All patients.
Okay, so I'm referring them over to you. So, so you're going to go through the criteria, ensure that the person's insurance covers it. If not, they don't cover it, and they want to proceed further. Of course, they understand what the cost of the care is.
Correct.
Then then the next is the shared decision visit.
Correct. And that's when it's a mandatory visit, a one-time visit for their baseline initial scan. And then for preceding years, they just come in for their scan through radiology. But at that visit, their entire medical history is reviewed, and the risks are reviewed with the patient. And if the risks of getting a scan outweigh the benefits, and so the nurse practitioner and the family will decide if for the patient, and as well as the patient, if it is something they should proceed with.
Again, a shared decision making based on the whole family situation, as
Correct.
well as what the possible consequences would be.
Correct.
And so the benefits, the potential benefits of screening individuals at high risk of developing cancer using this are?
The greatest benefit from the lung cancer screening is the early detection of the disease when it's most likely to be curable. As I mentioned earlier, lung cancer symptoms aren't always presented early in the disease. And unfortunately, it's not until later stages when a patient may notice these symptoms. So lung cancer screening, the biggest benefit is early detection. There's numerous notable studies that show how lung cancer screenings have greatly reduced the risk of dying from lung cancer because of its early detection.
As with any cancer, the earlier we detect it, the better outcomes are, the more likely that we'll be able to either put the person to remission or possibly even consider a cure for the patient.
Absolutely.
And again, it's another good reason to stop smoking.
Absolutely.
So let's go through, again, primary care doctor, who should I screen, who should I not screen?
Any current or former smoker. Primary care providers should be having that discussion as they do their clinical intake for a patient. It should be a discussion as if they are a current or former smoker. Current smokers, I would always recommend a referral to a tobacco quit program. And current or former smokers, as long as they meet the three criteria, the age, the pack years, and when they quit, if they're a former smoker, should all be referred to lung cancer screening. And again, if there's any uncertainty or any questions, you can always refer a patient and we can review with them. And again, at that shared decision-making visit, we can decide if they do meet criteria or not, and then we can proceed with getting the patient scheduled or let them know this is not currently for you, maybe in the future, or you can have a discussion with your primary provider. Maybe there are other imaging studies that would best benefit you.
Okay, so now they're coming in for that visit for the low-dose CT. What exactly is it like? A lot of people are scared of going into tubes and things like that. Stop me from the person walking into the leaving, what's done.
So you come in, you provide us with your insurance and your ID. We register you in our system, bring you back to radiology. There's no contrast involved. There's no pre-procedure blood work that's involved. Nothing, you don't have to fast. There's nothing on the patient's end that they have to do prior to the imaging study. It's actually a very quick exam. The patient comes in. We recommend that you don't wear any excessive jewelry or zippers or buttons to obscure anything on the chest. And the patient takes a deep breath, inhale, holds their breath for, I believe it's about 5 to 10 seconds. A quick scan is done and you're free to go. There's no post-procedure waiting. The imaging studies are reviewed by the radiologist usually within 24 hours, and then our team reaches out to you with results. There's no tubes, there's no anesthesia involved. It's not like an MRI. There's no loud noises going on, and it's very quick, very, very quick.
Actually quite important, because everyone, if you say CT scan, you say MRI, is scared.
Yes. Yes, patients are very afraid of the loud noises from an MRI or scans, as well as the claustrophobia aspect that's not present with low-dose CTs at all.
Again, so important that we're not claustrophobic, we're not in a big tube, we're not having the banging noise like an MRI machine, we're not having an IV put in us, we're not having contrast being put into, so we don't have to worry if the person has diabetes or renal disease that we're going to cause any problem.
Right, and no contraindications with any allergies with contrast involved, none of that.
If the person's on a blood thinner, doesn't have to worry about stopping a blood thinner, not taking a blood thinner. If the person is a diabetic, they don't have to fast, so they can do everything they normally do. And that basically the scan lasts as long as one breath.
Absolutely. It's very quick. Patients are in and out within a half an hour.
And all done at the RWJBarnabas Somerset Medical Center, Steeplechase Cancer Center, which is well known for the treatment of patients in the local community.
Yes.
And again, with the whole team approach to the treatment, starting from the beginning when they contact you, through afterwards when someone does contact them with the results.
Yes, absolutely. So as soon as the results are posted, the results come to our team. They are reviewed. Patient is always made aware of their results. They either we are on Epic, so patients are provided their results through my chart immediately as soon as they're posted. We also send out letters to the patient. Phone calls are always provided, and especially for patients that have a suspicious or positive scan, we immediately contact the ordering provider, let them know the patient's made aware, and then either further imaging is ordered or a referral to a thoracic surgeon in worst cases.
Okay, again, a whole community put together with ways that the person can find out both normal and abnormal results with good follow-up from the people at RWJBarnabas, Somerset Medical Center, Steeplechase Cancer Center. The fact that there are follow-ups, that we do have a whole team approach to it for if there is a positive.
Yes, and I work very closely with our program director, Dr. Ishan Patel, who is a hematologist oncologist here at Steeplechase, who has a very, very big passion for lung cancer patients. And so I work very closely with him to review all of our patients' cases and what the best referral would be for this patient.
Again, so the person is not sort of left in the limb.
No, absolutely not. And even patients that have a negative scan and are recommended to return in a year, we always communicate that with them, make sure that they don't have any questions, ensure that they are understanding of their results, and to let them know should any symptoms arise or any uncertainty within the next year to please either reach out to us or your primary doctor.
Again, real important, the fact that this is all done in the local community. I don't have to send someone to New York City or out to California to do it, that everything is local, so that, again, the result goes into my chart. And since since most physicians in this area are on Epic, and it's communicated to the patient through my chart, you send the letter out, as well as the same thing going to the patient's primary care doctor. If the patient needs a pulmonary or thoracic surgeon, easily able to see the results on the Epic system through the my chart, and thus everyone has clinically coordinated care.
Yes.
The fact that we have a team approach to it, that we have a team of oncologists, hematologists, who, God forbid something is abnormal, can help follow up on it and can help provide a team approach to how we're going to treat this patient.
Yes.
So the best of care at the local community hospital.
Yes, and if everything would be, any further imaging or any further testing that would be necessary, everything is done right here on site. God forbid, worst case scenario, patient was diagnosed with cancer and does require treatment. We have available options at oncologists here, right in Steeplechase, in our chemo and infusion suite. I hope we never have to see you here. I would like to keep you out of here as much as possible if I can. But should it ever be necessary, we have an amazing team of providers here on our lung program and in Steeplechase to care for our patients in the community.
So again, it's so important to understand RWJBarnabas Medical Center, Somerset Medical Center has the Steeplechase Cancer Center, which again is also, it has, partners with the Rutgers Cancer Institute. So if someone needs something, we have it. Absolutely. We have it locally. We have it available. We have nurse navigators who can help us get the person through the system. Yeah. We have nurse navigators that if the person has a question, they can call that person up and they'll get an immediate answer. It's not like calling the person, like calling your doctor up in New York and waiting 6 weeks to get an answer. You're going to get an answer immediately. You're going to get an answer that's an answer that you will be able to help the person understand what's going on.
Absolutely.
And you'll get the follow-up with the local physicians who have the expertise as well as as good as the people in these large facilities, but locally, so it's someone you could actually call, talk to, and you have enough of these support people who can help you through this.
Yes. A patient will never be left hanging. We have a general public line that they can call. I also always provide my patients, once they're scheduled, with my personal direct line as well. I've even provided patients with my work cell phone number. You can also reach Steeplechase directly. You can call radiology directly, and Robert Wood Somerset is amazing with communicating with their patients. We will never leave a patient questioning their results, their follow-up, when their scans are, when their imaging is. We have an amazing team here that communicates with patients.
So as we conclude today's show, key messages that we leave. Of course, first, most importantly, is how visionary the leadership at RWJBarnabas Somerset Medical Center, run by, the head Tony Cava, what they've understand how important the best of care in a local community center is, and how Steeplechase Cancer Center is so important to the local community. What are the key messages you want our audience also to understand?
Coming from a personal career history in women's health, I've always been an advocate for yearly screenings, whether that be your cervical screenings, your mammograms, as well as prostate screenings for men and colonoscopies. Early detection saves lives. I cannot stress that enough. If I can have anyone take anything away from today's visit, is early detection saves lives. And with lung cancer screening, that is our ultimate goal, is to catch something before it's too late, before it is advanced, before there's no curable treatment options. And with lung cancer screenings, that is what we offer. We offer that comfort of early detection and screenings, just like any other yearly screening that you would get. You should have your lungs checked if you were a current or former smoker, and as long as you meet the criteria. And any current smokers, I strongly recommend they be referred to a tobacco quit program and quit as soon as possible. It's never too late to quit, because I've heard it from plenty of patients. Well, I'm already 60, I'm 70. What's the point now? And there's always a point. Stop smoking. It doesn't matter your age. And so if we can get as many people in the community to stop smoking and get screened, that's our ultimate goal.
Thank you so much for being here. Thank you for what you do for our community, and thank you for what you do at the Steeplechase Cancer Center.
Thank you so much. I appreciate your time.
This concludes today's episode of Health Talk. Please remember, the opinions expressed here today by our medical expert are not a substitute for medical advice from your own physician. If you need a physician, please call us at 888-724-7123. For more information about lung cancer screening services at Robert Wood Johnson University Hospital, Somerset, please visit us at rwjbh.org/Somerset.